Corporation Foundation.
Good afternoon and welcome to the City Club of Cleveland. I'm Hewitt Shaw, President of the City Club's Board of Directors. I'm delighted to introduce to you today Bruce Broussard, the President and effective January 1 CEO of Humana, Inc., a Fortune 100 managed health care and health insurance provider and administrator serving over 11 million customers in the United States. Over the past 4 years and into the recent election, the issue of health care has been at the center of our nation's great policy debates, with implications beyond the health care industry impacting our larger fiscal policy and important social concerns. We are fortunate to have with us today Mr. Broussard to share his insights on that industry and this developing policy. Prior to joining Humana in 2011, Mr. Broussard was an executive with McKesson Corporation, and before that, U.S. Oncology, large producers and providers of healthcare products to major healthcare institutions. So with that background, Mr. Broussard brings to our podium today a broad perspective on the healthcare issues facing our country. Mr. Broussard holds his undergraduate degree from Texas A&M and an MBA from the University of Houston. Mr. Broussard, we're very much looking forward to your comments today on this very important topic. Thanks for being here.
Thank you. Thank you. Thank you, Hewitt. Well, thank you. And I really appreciate the opportunity to address each one of you. As we talk today, our nation is actually wrestling with one of the largest issues probably in a long time, and that's our debt and the large amount of debt that the United States is facing today. I will outline the challenge we face. I will also show you some transforming health care is one of the ways that we can solve this debt issue. I'll demonstrate how new approaches through integrating the delivery system and how it is already achieving some results outside of the federal government. I'll actually describe how healthcare can harness simplicity to have sustainability, even as the healthcare system undergoes some significant transformation. First, I want to take a moment and talk about Ohio and Cleveland and how they're addressing some of these large issues here locally. Particularly the recently announced demonstration of integrating care for coverage for the dual eligible, which the dual eligible are individuals that can be covered by Medicare and Medicaid. I don't know if you know this, but dual eligible population represents 20% of the Medicare population today, but 31% of the cost. We are excited to be part of this program under a strategic partnership with a company in Dayton called CareSource. And we'll be serving beneficiaries in Cleveland and Akron and Youngstown. Our partnership with CareSource pairs our chronic ability and also managing complicated conditions and their experience as being the leader in serving underprivileged people in healthcare for the last 23 years. It is this type of partnership designed to integrate care and simplify the healthcare experience for elderly and disabled individuals, I will be talking about in a few minutes. We have a strong commitment to Ohio, as it is one of the 6th largest states with a Medicare population. Our commitment to this is to improve the health and lifelong well-being of our members through a comprehensive program of preventative care, care coordination, chronic conditions, and the company-wide dedication to member experience and customer service. Another way we're demonstrating our commitment to health care and well-being is our extensive work to help people better their lifestyles and live a more active life. We know the root of the country's problem in health care is unhealthy lifestyles of most Americans. At Humana, we are battling this issue with a great many fronts, and two of the most exciting of them are here in Cleveland. Just 8 weeks ago, we joined forces with Cuyahoga Metropolitan Housing Authority to build a new multi-generational playground just a few minutes east of here in Addison Townhomes. 150 volunteers from Humana and the community teamed up to build a place where kids, adults, and seniors can play. The Addison Townhome play space was one of 25 we've done since 2011 and built across the country as we plan to do many more over the coming year. I'm equally proud to tell you that we are one of the planned sponsors of the National Senior Games that will actually take place here in Cleveland in July 2012. Senior Games are inspirational and a perfect example of health and well-being among the seniors. As a business leader and being part of this for many years, I encourage each one of you to get involved in the games and at least make the point to visit as a spectator. However, right now, the work we do, the work each one of you do, has a cloud hanging over it. And that cloud is our national debt crisis. As you likely know, the U.S. national debt stands at more than $11 trillion and could double in one decade. In addition, if you add the money that the government owed from the trust funds, our debt exceeds $16 trillion. Now, to place that in some context, it is increasing by the minute by $2 million. Humana strongly believes that if we do not address our debt issues, our nation's economy will suffer repercussions from slower growth and a fiscal crisis. We must come together as a nation to fix it with a need of comprehensive bipartisan plan that addresses revenue, including pro-growth tax reform, spending, and entitlements. Humana is involved in the organization called Campaign to Fix the Debt, founded by Bowles and Simpson, and led with a group of state and federal policy thought leaders from both sides of Congress. We believe the campaign will make a difference in pushing Congress to a smartly and responsibly to enact a comprehensive deal. And I encourage each one of you to lead and get involved in the fixthedebt.org. And if you would like to have any information afterwards, I'd love to talk to you about it. But meantime, we recognize that healthcare plays a significant role in our nation's spending. Controlling healthcare costs is linked directly to our fiscal security. We already spend 16% of our GDP in the U.S. on healthcare. For this, we have a lower life expectancy. We have higher infant mortality than many developed countries. We are much more obese. We overuse medical services, much more. The U.S. has 26.6 MRIs for every 1 million patient population. That compares to 6.8 units for developed countries. Chronic illness is prevalent and is rapidly increasing. 75% of our health care dollar today is spent on chronic conditions, of which many are preventable. The cost of care varies hugely and irrationally from hospital to hospital and doctor to doctor. Worst of all, waste and fraud and duplication of medical services cost the nation $750 billion a year. You also wonder about the impact of the 2010 Affordable Care Act, also known as health care reform. Many major provisions are scheduled to take effect in 2014, just a little more than a year from now. The Act demonstrates projects designed to improve the delivery system. It also opens access to coverage and projected to cover millions more individuals. Still, it does little to address the major problem in healthcare, and that's costs are rising, and they're too high. But in reality, they're unsustainably rising too fast. Clearly, something must be done to stabilize the programs, like Medicare, but also to address the sustainability across the entire healthcare system. The private sector is already playing a key role in leading and changing reforming our system. What I want to talk about today is the way to simplify healthcare as the means of putting it to finally to a sustainable level. If you look at healthcare from the point of view of the average person, the system is unbelievably complex and fragmented. Healthcare decisions often involve many choices and overwhelming amount of information. Healthcare bills and statements are arcane in their complexity. Even finding the right specialist or facility can be fraught with guesswork and uncertainty. We must simplify our approach to healthcare, attack the rising costs and other issues for the ordinary American can understand and act upon in order to create sustainable healthcare delivery system. A simple, comprehensive, actionable view of a fragmented system is the key to creating sustainability. As health insurers, we are one of the only ones that have such a view. Our old role was to provide oversight to the customer through actuarial science and through claims management. Our new role is to create an integrated delivery model driven by primary care providers that uses shared data at the point of care to improve outcomes, lower costs, and create a better health care experience. At Humana, our model integrates our delivery, data support for clinicians, pharmaceutical solutions, and wellness and productivity platforms. In many ways, our model is an evolution with its roots prevalent 20 or 30 years ago. But today, simplicity is the key. We believe an integrated delivery model that emphasizes primary care can provide outcomes, lower the cost of care, especially to patients with critical or complex medical needs, including the patients in the Medicare and Medicaid program. The concept relies on primary care physicians to coordinate care for patients, helping them navigate the healthcare system so they can receive the right care at the right place at the right time. Like many organizations and industries, technology plays such an important role in enabling this to happen. We are investing in today in data analytics capabilities that identify gaps in care and support physicians and patients with accelerated information. One example of that is our Envita subsidiary, which uses sophisticated algorithms and predictive models to identify individuals before critical health events occur. In a month, Envita identifies more than 400,000 members needing an intervention and produces over 800,000 messages, calls, or care alerts. Conversion rates for these interactions stand at 34%, meaning the member got the message, took the action, and the gap in care was closed, leading to higher quality and lower cost. Our vision includes technology that enables practice management, practices that use different electronic health records to exchange information and talk to each other. This allows physicians to share patient information in real time, which can further reduce the gap in care. We also support health plan members with an array of services and programs designed to maintain health and address chronic conditions. We start with personalized feedback for members through a health assessment and biometric screening. This feeds into Humana Vitality, a personalized health and fitness portal that rewards the member for following a customized exercise, diet, and lifestyle plan. Essentially, we're borrowing from other industries to create an experience like a frequent flyer program. The more our members engage in healthy behaviors, the more they will be rewarded, ranging from everything gift cards to merchandise. A peer review study of participants shows it works, reducing hospital costs by more than 7% for participants with cardiovascular disease and 15% for participants with cancer. For our members that need frequent and ongoing clinical care, our Humana Cares program for senior members with chronic conditions is another good example. In Humana Cares, these sophisticated predictive models I just discussed identify individuals before the critical events occur. Humana Cares blends an on-site and telephonic support, uniting acute and chronic management through the early identification of gaps in care. Humana Cares group develops individuals' self-care goals and supports behavior through the proven techniques, including in-home visits designed to help seniors age with grace. When people connect with Humana Cares, good things happen. Data shows that hospitalization reduced by 33%. Emergency room visits have decreased by 13%, and readmission rates have decreased by 26%. Humana Cares is a window into our dream to help people achieve lifelong well-being. But well-being is, for us, is centered on long-time work and physical health. But it's much more. It also embraces financial and personal security, social and community belonging, and vocational purpose, and producing lower cost, better quality, better outcomes, and better member experience. Our most extensive experience with this holistic integrated model comes from our Medicare Advantage population, seniors and disabled individuals. Unlike original Medicare, which merely writes the checks for services and providers sends in the bills, Medicare Advantage incorporates integrated system of care like a Humana's model. Empirical evidence shows that Humana's Medicare Advantage plans deliver higher quality of care at a lower cost than the original Medicare. A higher percentage of Humana Medicare Advantage members receive preventative services at a difference of 7.3% than the original Medicare. Humana Medicare Advantage members receive care for nearly 15% less than the cost of comparable care through the original Medicare, with no reduction in quality. One state retirement system that switched to Humana Medicare Advantage plan saved $31 million a year in their first year. Results like this does not happen and only happens because of close coordination, cooperation, and collaboration between the various participants in our fragmented healthcare delivery system. As I mentioned earlier, there's a strong provider component to a commitment to sustainable delivery system change. Doctors and hospitals absolutely must commit to practicing evidence-based medicine. They also need to wire themselves into a comprehensive electronic network that includes other providers, their patients, and payers like us. But while the news coverage focuses on healthcare reform, the private sector, including both providers and payers, is accelerating the adoption of a delivery system reform that already makes a difference. In summary, out-of-control healthcare costs are the problem. The solution is an integrated care that combines data, technology, and simple, customer-friendly, and healthy programs. The results will be better quality, better outcomes, lower cost, and better healthcare experience for the people we serve. So thank you, and I think we'll open it up for questions.
We are honored today to welcome Bruce Broussard, President of Humana, Inc. We will return to our speaker momentarily for the traditional City Club questions. Please formulate your questions now and remember to be brief and to the point. We welcome all of you here and those listening to 90.3 WCPN Idea Stream, WCLV, WTAM, or one of the many radio stations across the country. Our television broadcast partner is WVIC PBS Idea Stream. Television broadcasts of the City Club are made possible by Cleveland State University and PNC. Our live webcast is supported by the University of Akron. Closed captioning of our programs is made possible by Nordstrom Corporation. We would like to welcome today our guests at tables hosted by Humana, Humana Medicare Division, and Medical Mutual. Thank you for your support. We would also like to welcome to today's program students who are joining us from area high schools. Student participation is made possible by a generous gift from the Charles Spar Charitable Trust. Today we welcome students from Walsh Jesuit High School. Would the students please stand to be recognized? Now we would like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everyone, including guests. Holding the microphone today is Program Director Carrie Miller. May we have our first question, please?
Mr. Broussard, you talked about the complexities facing the average American patient or the American medical system, and certainly are complex. And with the new insurance exchanges coming in the next year or so, that will certainly not make it more complex. My question is, I noticed from the program notes today at the City Club that Humana played a part in the drafting of the Affordable Care Act. And my question is, why didn't Humana and the others who are playing a part in that try to copy the system, which is very simple in Canada and other parts of Europe, of having a single payer take care of all medical expenses?
Sure. Yeah. Good question. And we probably could be here quite some time to answer at that. You know, from our vantage point, what we see is that the system that works in Canada is still expensive, and it is also does not have the care level that is here in the United States from the standpoint of technology, and even in the European countries, specifically the UK. They too have a one-payer system, but what's happened is that one-payer system has caused long lines. Healthcare is delayed of getting to people, and in result, there's a private sector that actually gets formed here. We as an organization are a big believer that the integration of care into a simpler model where it is all under either one roof or enabled in a society that can access care at a single point and then be able to be used across the platform as a whole. But we're not a big believer in a governmental sponsored only plan because it does not encourage innovation and it does not encourage competitive aspects, and we think that the competitive aspects will only make us better going forward. So.
Bruce, a question slightly off topic. Being a Texas A&M guy, what do you make of Johnny Manziel, and can he win the Heisman?
Well, I got to tell you, the school is making me proud. I think the years that I've been associated with Texas A&M, I've never seen a better football team, and I think he will win. That is off topic.
Mr. Broussard, I want to comment and give you some background first. I am a Humana Medicare Advantage subscriber through my wife's retirement through OPRS, and generally very satisfied with the program. Particularly enjoy the Silver Sneakers relationship to encourage exercise. And I was pleased you mentioned the senior games here in Cleveland next year, 2013. Yep. I will be participating in the swimming.
Oh, good for you.
Because already qualified, because you have a qualifier the year before. My questions are multiple, but let me, first of all, Medicare Advantage plans got a fair amount of criticism during the discussion of the Affordable Care Act as being more expensive and not performing at the level they should have, essentially. Now, I know you maintain that yours are doing well. I'd like to know the broad spectrum on that question more than what just Humana is doing, but are all of them doing well? And the other piece that goes with that is there was a lot of talk about this saving of money from Medicare to help fund the Affordable Care Act, and part of that I thought was to reduce Medicare Advantage plans. How is that going to affect things?
Yep.
And then really the third part of the question is there significant broad-based data to show that change in lifestyle has changed healthcare cost curve downward? Not just yours. You give a lot of percentages. I'm really looking at what's the total population seeing.
Okay, well, you might have to help me out with those because my memory is a little bad. I only can do 1 or 2 questions. When you get to 3, it's a little more complex, but let me try. You're exactly right. The one complaint with Medicare Advantage early on was that it was costing the federal government more than traditional Medicare. And it was really not around the effectiveness of the plan, in other words, how effective the plan was. It was really around the rates that they were paying. And so they were paying above the Medicare rates at the outset. And really why they did that in the early part of the decade was around stimulating and getting that going. And what's happened, it relates to your second question around the savings that is coming from Medicare Advantage, is now they're beginning to move those rates to Medicare fee-for-service rates, which are coming down, and then they're actually now using that to fund other resources within the Medicare Advantage program. And in fact, in some of the regions, because it is regional based on how they are adjusting those rates, now they're actually below Medicare rates. So we have regions that we now offer services in that they are 95% of Medicare. But what that's interesting about, and this gets back to maybe a little bit of the question you were asking around a single payer system, it motivates us as an organization to be more innovative in ensuring people are healthier and they're being treated better. Because if Medicare Advantage, the way it works is that we get paid a fixed payment. And the beauty of our relationship with individuals like yourself is that we have a 7 to 10 year relationship with you. And so we want you to be healthy. We want you to be in the right areas because if you are healthy, we do better. So our interests are aligned in that regard. And so as we see this, we become more innovative. As our rates come down, we become more innovative of how to be much more effective in the cost side. And to us, that is really the picture of the future of healthcare, is when you see Medicare Advantage, it might not be called Medicare Advantage, but the components around being paid for quality, being paid for managing the care, and being able to help individuals both navigate the system, be healthier, and at the same time continue to find the right place at the right time to be treated. So, your last question was around healthy behaviors. What you're doing, being active, I'm assuming you're eating right, you look very healthy, is the right thing to do. It's not only the right thing to do from a health point of view. I did see you sneak that cookie in, but I don't want to say anything. But it's not only healthy from the standpoint of prolonging some kind of chronic condition. Just to give you a statistic, we have 600,000 diabetics that we are as of members, and usually 2 to 3. They usually have 2 to 3 chronic conditions. So what happens is one condition then leads to another condition, which leads to another condition. So living a healthy lifestyle helps prevent that from happening. But what we also notice is living a healthy lifestyle helps the brain. And it helps people be more engaged and longer and live a life that's much broader than just being healthier in that regard. And so you see our dream of lifelong well-being wraps around not only the physical health, but the mental health. And we do have studies that actually demonstrates that the ability to have an effect on care is directly related to your lifestyle in that regard. And I think diabetes is a great example of that, and probably one of the most expensive diseases we face today outside of cancer as a result of bad habits and eating. Now, some of it is hereditary, but most of it is what we do to our body every day.
You spoke about the excessive, unneeded use of medical services and irrational spending. Do you believe that that is due to a flaw or a problem in the healthcare system? Mm-hmm. And if so, please explain.
Boy, what an insightful question. Yes, it is a flaw. There's two aspects of the healthcare delivery system that really has gotten us to where we are as a society today. One is its fragmented nature. So everyone is only caring about their own silos, so to speak, in that regard, and that creates a consumer experience that's very difficult. And the second aspect is we pay for what we do. And so an individual that owns a imaging device gets paid for every time they turn that imaging device on. And so what that does is it encourages more and more use as opposed to the outcome. And the outcome is a healthier person. And so what needs to happen and what's transpiring in the private sector is moving payment to not what you do, but it's the effect of what you've had on health. And so when I talk about Medicare, we're not motivated to do more MRIs. We're motivated to get him to health effectively. And so the flaw in the system has been we're paying for, we call it piecemeal, individual services, as opposed to paying for the outcome as a whole. So.
You mentioned silos and how we're viewing everything in fragments. How about a silo of the young people with the Affordable Care Act and so forth? Do you think that there's an understanding among that generation of all the implications for them, including cost?
No, I really don't. And there will be the Affordable Care Act will raise the cost of insurance for younger people. No ifs, ands, or buts about it. And the reason for that is because there is an aspect in the bill that's called community rating, and that insurers have to take everybody, no matter if you're sick or healthy. And there's also a aspect within the bill that you only can charge so much. The difference between the lowest charge you have for an individual and the highest charge you have for an individual. So what that's going to cause is healthy people their costs are going to go up, and the unhealthy people are going to stay the same or go down a little bit. And in addition, what you have is you have a lot of unhealthy people that were uninsured coming back into the marketplace. So these confluences are going to cause the rates to go up in that regard. And the healthier, younger people are going to pay more. There's no ifs, ands, or buts about it, that aspect.
I think one of the most compelling points of your discussion today was your reliance on primary care physicians. But unfortunately, the stats that I read say that we don't have enough now, and there's even fewer in the pipeline. So what's Humana going to do about that?
Well, I do. First, we would love for the federal government and industry to help stimulate more individuals to come into the primary care profession. So that's one, and we have activities that are going on in that context. But more importantly, similar to other industries, how do we get them more productive? How do we help them in their day-to-day activities to gain more productivity? And there's multiple ways that we are working to do that. First is technology. I talked a lot about our Envita and our ability to proactively use data to identify events before they occur. That helps in being able to stop reactive medicine and more proactive medicine in that aspect of that. I also talked about our Humana Cares, where we have close to 5,000 people that go to the home for chronic conditions. That takes the pressure off the primary care individual for having to deal with that, but whether it's reactive or proactive. And then the third area is continuing to advance the physician assistance area and being able to leverage nurses and allow nurses to continue to grow in their profession, to be able to be an ally to the physicians, where now the physicians can delegate to the nurses in that regard. So technology, continuing to encourage people to go into the profession, and at the same time a change in the way we deliver health care as a whole. But we are fully aware, and we will have a primary care shortage as time progresses unless we do something in those areas.
Thank you. I have a question on Part D of Medicare, the drug. It's my understanding that the government is not allowed to negotiate drug prices. Is that correct?
That is correct.
Okay. Say that I have two drugs that I take. One is on Humana's formulary of drugs, but not the other, and my other drug is on Anthem. But so I have two drugs, and only one is allowable by one healthcare provider and the other. Could you address that, please?
Sure. Let me try to address it in different levels. Relative to negotiating by the federal government, it really is the negotiation of the federal government to the pharmaceutical companies. So today there is actually a restriction that the federal government can't use the purchasing power to negotiate a bulk purchase to the pharmaceutical companies. It's really not to us as Humana, it's really to the pharmaceutical aspects of that. So when you look at your next question, I'll come back to that. It's really not wrapped around that area. What has happened in Part D, and actually President Clinton referred to this in his speech at the Democratic Convention, it is actually bringing the cost of the pharmaceuticals down. And what it's doing is similar to what I was just talking about relative to capitalistic competition. We did a joint venture just a few years ago with Walmart, and we introduced a $15 a month drug plan. $15 a month. And the industry thought we were crazy to do this. But what we did is we worked with Walmart's purchasing power, Walmart's distribution capability and management, and our ability to bring solutions to our members and brought a product out. What that has done is has brought down the price of Part D significantly in the industry. This year, United came out with a $15 plan, and now is doing it with Target and CVS. And what that's doing is it's bringing competition to the marketplace. You're right, maybe you can't take the Anthem plan and the Humana plan at the time of purchase and use those individually, but the thing about Medicare Advantage or Part D is you can walk the next year. And your ability to walk from one plan to another plan motivates me to deliver an experience as best that I can and a price that is the most cost-effective fashion. And then that motivates our leaders in our organization to be innovative, to be able to bring joint ventures like Walmart out. Another great example is with Walmart, we just brought out a plan on healthy foods. And we are actually, if you go into Walmart and you're a Humana member and you get your Healthy Foods card, you get a discount on buying healthy foods in that area. And it is sponsored by Humana. And again, this gets back to our belief that we want to take care of your health as opposed to worrying about the procedures that are being applied. We want to find a way to get you healthier. And when you're in some chronic condition, we want to find a way to get you back to a lifestyle that will allow you to be productive in that aspect.
Over here.
Hi,
I like your idea of personal responsibility. And you mentioned at the beginning of your talk about fix the budget. And aside from all of us being willing to pay more taxes or having to pay more taxes and staying in shape, I would like you to expand on the idea of what individuals can do to be personally responsible to fix the debt.
Well, there's a short-term aspect and there's a long-term aspect. I think in the short term, we're going to have to fix it because of we've postponed this so long, and I think it's going to be a blend of taxes and entitlement changes. So the individual today is probably speak their voice. That's the best thing we can do today. But I truly believe we have to speak our voice, because if we don't, some point in time this is going to come and fall down on us as a country and have worse consequences. But in the long run, for us to be effective, we have to get control over the entitlement program. That doesn't mean that we take entitlements away from people. We make it much more productive. And our goal as an organization is to take that responsibility on by lowering the cost of health care through innovative ways that not pushes risk from one organization to another, which is what insurance companies did for so many years. It's to take it on and bring programs like Healthy Foods out, bring programs like Part D where we're able to offer $15 solutions, be able to offer Humana cares and other things where we can begin to affect the cost of care in that way. As I mentioned, in the healthcare today, which is our vocation, I know a lot of it, so I'll speak mostly to that, there's $750 billion of waste a year. Can you imagine what $750 billion, if we were able to put that back into the system, would do for our budget? And to me, those are the things that we're looking to the federal government to incentivize people to take responsibility for that. And that's where Humana is leading in being able to help the healthcare system for that. So individually, speak your mind. That's the best thing you can do. Long term, let's get an impact on the productivity of our entitlement program.
The Affordable Care Act has some features in it like accountable care organizations and health homes, which are designed, I think, to address those same things that you're talking about. Right. Can you talk a little bit about how those work and how they fit with some of the things that Humana is doing?
Yep, good. There is some programs, and I mentioned briefly about the demonstration aspects that are going on, and the federal government identifies the problem of fragmentation and the fee-for-service aspect as being the problem child of our healthcare delivery system. And so how do we take that on in a very, very fragmented industry in that aspect? So integrated care is what they're focused on, where they pay somebody a fixed payment and that individual takes the responsibility for someone's health care. Well, that sounds very familiar to Medicare Advantage. And so when you look at Medicare Advantage and as you look at Humana's capabilities of being able to manage across the system and being able to help individuals navigate that journey of a fragmented industry, it's Medicare Advantage. And that's where we are big believers in items like ACOs and medical homes and so on in that aspect. And we believe that if the industry would get behind it, it will help in the cost of health care in that regard and wrangle that $750 billion out of the industry as a whole. But there's a lot of coordination that needs to be required there. And there's a lot of egos that have to be put down to decide who's at the front of the bus driving and who's on the bus riding. And that's where you start to see the political issues that take place from hospital system to hospital system, physician to physician, et cetera, and being able to bring that alive. So we are big components of the idea of ACOs, and we want to be enablers in making that happen. I think where the challenge will be is the political local affairs that happen, and how does it get off the ground in that aspect of that. Today, we think the Medicare Advantage program is a great example of that. We think as time progresses, we will continue to take those skills and help other organizations be able to do that. And we're doing that today. In fact, we have a number of relationships in local markets that we are actually facilitating the ACOs with some of the backbone that we have as an organization. So.
Good afternoon. When you were talking about $750 billion of waste in the system, are you including Medicare waste?
Yes.
You are. How much of that is Medicare?
Well, Medicare is about 40 or 50% of the health care spend, so I'll just extrapolate from that. But I will tell you, probably there's a lot more waste in Medicare than there is in commercial because the policing of it is much harder than a commercial book of business.
40% of the $750 billion is Medicare? Minimum. Okay, so what is being done about that? And what should be done? And has your vast organization proposed anything to be done to eliminate waste in Medicare? Because if you don't tackle that, right, you could talk forever about the other aspects of waste.
Well, a few things there. I think in general the waste is coming from duplicated services, for example. It's coming from fraud and it's come from just inefficiency relative to where the individual is being serviced. So where we are in Medicare Advantage, and one of the reasons why we're about 15% below Medicare fee-for-service, is really a result of our programs that are eliminating that. So I talk about Humana Cares. Let's talk about Humana Cares as an example. Our objective is to continue to keep people at home in an environment that they feel most comfortable with as opposed to an institution. So we measure in our organization readmission rates. I mentioned that we've reduced 26% readmission rates. The goal there is to continue to encourage people to stay home and be able to take care of them at home. That helps with that waste in that regard. The ability to not have duplicated diagnostic services are an example of that. And someone overlooking the whole individual has that observation as opposed to the silos.
So, we go back to the Medicare for a second. Where is that waste, and what have you seen as an organization the waste being, and how would you suggest that that be tackled?
Okay. The waste is across the platform. I mean, I think if you, this week, or there was an article in the New York Times around fraud and some of the activities that are going on in that area. So fraud's a component of that. But for us as an organization, the largest waste is the lack of integrated care. And what that means is duplication of services and where people are in the wrong aspect of that. I saw you shake your head, so I must not be answering your question.
Thank you for a talk which demonstrates one of the things that I find very encouraging about this Affordable Care Act that we're now beginning to embrace. And it is exactly the tremendous focus on how it plays out in the marketplace. Right. And Humana is setting itself up as a model player in a complex game that involves lots of bargaining, lots of incentives, rewarding behavior you want. But I am struck looking back on the last election and the discussion of Obamacare that it seemed to get a bad rap as a quote-unquote government takeover. And it really was conceived of as almost the opposite, an effort to make the private marketplace function better with better rules. And I would like to hear from you if you agree that it is in fact a market-centered effort and is not a government takeover.
I think at the higher, where the dollars are going to be spent, and I mentioned a little bit about the insurance side, it is going to have a cost increase from an insurance point of view. More people will be covered. It's a great aspect of it, but it's going to cost the American individual more dollars because the risk profile is changing. Now, probably will not be as active in the individual exchange market as others will be, but you will see an increase in that regard. And I think the reason why I say that is that has not come out in the healthcare reform debate, and the knowledgeable people in the back room are raising that. But we are a big believer in 2014 for individuals that are non-Medicare, they're going to see their rates go up. And no ifs, ands, or buts about it. I think where the reform helped is in the demonstration areas. And you don't see a lot of that coming out today, but they really encouraged electronic connectivity through bringing the electronic medical record to the provider, and they encouraged a holistic view of the individual around these things called the accountable care organizations and medical homes and those things. And we think long term those will have an impact. They might not be called an accountable care organization, but they're in the right zip code. And so when you look at it from a taxpayer point of view, in the short run, they're more looking at what is it going to affect from a cost point of view and the dollars that's being pushed around in the industry. Long term, I think there will be a lot of benefits from it from the electronic point of view and from a structural change point of view because we're going to learn a lot as that aspect. But so there's a short-term view and a long-term view. A lot of people are focused on the short-term aspect of that and the funding that's going to be required for that. Yes.
I would like you to comment on the exchanges that seem to be somewhat controversial.
Mm-hmm.
I do believe that our governor has said not now, and that would, if he continues that position, lead to a federal exchange program in Ohio. What is Humana's approach to exchanges? Do you prefer federal run or state run?
We do believe in the Medicaid system closer to the population, i.e. the state, is probably a better way to do it, because I think that's the most appropriate way to get care localized in that aspect of it. Causes more complications for individuals like myself, because now I have 50 customers as opposed to one customer, but we think is better for the care model point of view, because healthcare is local. And it's not a national business, and it can't be exported, and it can't be anything. It is a local business that has to be delivered. So our preference is at the state level. Our perspective on exchanges is we have a perspective of walk before you run, and I think that's what your governor probably has that perspective on, is to learn a little bit before you jump in with everything getting wet here. And the reason being is because so many moving parts are happening here. I mentioned a little bit about the pricing model is changing because you have this ratio that you have to stay within. In addition, you're going to bring a lot of people on that traditionally have not been insured, and you don't know what their health conditions are, and you don't know what that means to the cost of care in that aspect, and you just don't know where that goes. So I think we have the philosophy of let's take baby steps before we jump into it, and I think that's what your governor has.
One issue we have not addressed today is the delicate issue of the disproportionate spending on health care in the last days and weeks of one's life. Mm-hmm. And given the dubious nature of outcomes at that point, what is Humana's position in this area?
I might have bread thrown at me or cookies or something here. I come out of the cancer business. I ran and was the CEO and chairman of the board of one of the largest cancer companies in the United States. And Into Life was a very, very active part of our organization as a result of that disease. And what I learned in many, many dialogues with the 2,000 physicians that were part of our organization is the Into Life is best spent in a time of non-treatment. It's a tough decision because people don't want to give up that hope and promise, and doctors aren't paid to give up, or they're not trained to give up, and that discussion is a very hard discussion to have in that aspect of it. But it is something that I think it will never come from society in a policy, but I think over time having hospice be part of the treatment plan is an important part of that. Now, in our organization, we never encourage that because that is really the right of the physician and the right of the family member in that regard. But we do offer services, social workers, and other means through our Humana Cares relationship that allows them to deal with those tough issues in an educated way and resources to help. And I think that's where we look at our responsibility is to help them navigate that decision. That's a personal decision and a hard decision, and let that decision be on the family members and the provider. But we are believers that hospice, especially in circumstances that it's not promising, is the right way to do. And so you take it from a cost discussion to a quality of life discussion. And to me, when you make that quality of life discussion and make the right decision, the cost discussion will bear out there.
If I understand your point, it is that integrated care is what's going to lead to the efficiencies to eliminate waste and to bring down the cost of the entire healthcare system.
You probably just answered the question he was trying to ask me 15 different times. So.
The devil, of course, is in the details. Yeah. Who is going to be making these decisions as to whether care is provided or not? We all remember it wasn't so long ago that thanks to our insurance companies, we had to go to a primary care doctor to get permission to go to a specialist. Yeah. Is it the primary care doctor? Is it the insurance company? And who makes the financial decision? Because that's really what is going to drive the whole thing.
Yeah, a great question. I'll give you our perspective. And Our perspective is the physician is at the center of healthcare. And we believe that the physician, along with the relationship with the individual, is where that decision is made. We don't believe it's a hospital. We don't believe it's a payer. We don't believe in anything like that. We believe it's the physician that makes that decision with the individual. We do have a bias to primary care because we believe that primary care sees the overall aspects of it in consulting with specialists and having specialists by their side, but we believe that the primary care has a much more holistic view of the care model than just a specialist in that regard. But specialists are a very, very important part of the healthcare delivery system, but used in an appropriate fashion. We do also believe that some skin in the game by the individual, especially on the commercial side, is an important part. Because if you think about healthcare today, the individual paying the bill and the individual providing the service and the individual that is receiving the service are three different groups of people. And they have three different really interests in mind at some point in time, and they are not always aligned. Our belief is aligning those interests together, both having more empowerment by individuals in their financial participation in it, and having the physician more incentivized around quality and cost, not just around doing the individual units of work in that regard. So we look at it, primary care as being an important part and really being one of the lead in the care model with a partnership with specialists, but the primary care is the center part. We believe payers and so on should be in the background, not in the foreground regarding to this, and we think a more closer connection between quality and cost in the reimbursement system is important.
Today at the City Club of Cleveland, we have been listening to a Friday forum featuring Bruce Broussard, the president of Humana, Inc. Thank you, Mr. Broussard. Thank you, ladies and gentlemen. This forum is now adjourned. Thank you.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.
PNC is proud to support the presentation of this City Club of Cleveland Friday Forum on WVIZ PBS.
Additional support comes from Cleveland State University. Support for closed caption transcripts of City Club forums is provided by the Nordson Corporation Foundation.